Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to go over the banded dead bug exercise. This is great for not only core stability, but also pelvic control, especially with movement of the leg or hip flexion and extension. So how we're going to do it is we're going to lay on our back with the band right around the mid-foot there. We're going to bring our feet about hip width apart, okay? We're going to flatten our back against the ground, and that's going to kind of pull our pelvis a little bit closer into a posterior pelvic tilt, okay? The important thing with this one is we want to make sure that our pelvis stays in position and that our low back stays in position. So big thing is, as I extend the leg, I don't want to pull my back off the floor and let my pelvis dump forward, okay? So we're going to get our brace, right? Breath in, and then we're going to dorsiflex the feet. We're going to hold one leg in place, brace the core, and then we're going to push the other leg, okay? So what I should feel is the front portion of the leg working to kind of keep that foot dorsiflexed. I should feel my quad and my hip flexors start to work, but I should especially feel my core working in that position too. So same thing on the other side, right? Keeping dorsiflexed, keeping that leg in position and really engaging the core to keep my pelvis in that position. I'm going to push down, squeeze core, and notice how my back doesn't change positions, okay? So one of the key things with this is if I start to dump into extension or an anterior pelvic tilt in that position, the hip flexor gets a little bit more strained on that side because it's a bit more lengthened. So learning to keep that pelvis engaged, right, in a neutral position will allow me to use more of the core and keep that hip flexor in a more natural kind of shortened position rather than lengthened and stretched. So we're going to do this for repetitions on each side, making sure that we're challenging it, but keeping everything in a neutral position as we go along. Okay, so this exercise is great for runners or any sort of like hip impingement pain, where a lot of that kind of pain comes from instability or like too much movement in the hip or too much kind of like pelvic tilt causing a little bit more of like a pinching when that hip flexes. So great exercise. Give it a try and let us know if you have any questions.